Hi there, my name is Dr. Pat Camp and I'm an assistant professor at the University of British Columbia, and I also run the Pulmonary Rehab program here at St. Paul's Hospital. I'm here today to talk to you a little bit about pulmonary rehab and about some of the exercises that you can do for your COPD. So just follow along with this video and please don't hesitate to watch it again until you're familiar with the exercises that we've described here. As you know, COPD is a lung disease, and although you know that it makes you feel short of breath, it also has a lot of impact on your muscles and your overall body function. You may find that as you've become more short of breath as the years have gone on, that you've started to decrease the amount of activity that you've done. And unfortunately, when people slow down or reduce their activity, their muscles become weaker. And weak muscles need more oxygen. And so you might get more shorter breath, and so you start decreasing your activity more and more. And in time, what can happen is that sometimes people with COPD can actually become so short of breath that even very light activity makes them quite breathless. So it's really important for you to change that and to start to become more active, even though you may have shortness of breath. And so this video is going to show you some exercises to try to help you improve your activity level, help your muscles get stronger, and hopefully reduce some of that shortness of breath that you've been having. So before exercising, it's always important to talk to your doctor to make sure that you're safe to exercise. You may have other kinds of chronic conditions that may make exercise a bit more challenging, and you want to have a good talk with your doctor to make sure it's a good time for you to start an exercise program. Sometimes you don't even have a pulmonary rehab program near you, and so these kind of exercises are things that you can do on your own. But if you do have a pulmonary rehab program in your community, you may ask for the doctor to refer you to the program. So what are some of the benefits of exercises? Well, the body is a wonderful thing. If you use it and exercise and get stronger, it will use oxygen more efficiently, and you'll be able to do some of those activities of daily living much more easily and hopefully with less shortness of breath. You may even find that you don't need your inhalers as much as you used to. If you learn how to control your breathing and your muscles get stronger, you may find that better shortness of breath or decreased shortness of breath actually means that you don't need some of those inhalers as much. But it's important that you talk to your doctor before you change your medications in any way. So there are three general types of exercise, and we like to group them into aerobic exercise, or what some people call cardio exercise. There's also exercise called strengthening, and that's the exercises that we do to help your muscles get strong. And there's also stretching exercise, and these are the flexibility and stretching movements that you do to keep your muscles and your joints loose. So what's aerobic or cardio exercise? Well, this is the big body exercise using your large muscles in your legs. And the idea of cardio or aerobic exercise is to get your heart rate going. Not too high, but it has to go up a little bit more than resting. And the purpose of this is just to improve your overall walking and day-to-day activities. So some of examples of aerobic or cardio exercises are walking. Even light walking can be enough in some cases to get your heart rate up. Swimming, cycling, or even using a stationary bicycle, dancing, anything that allows you to move your whole body and to be doing it for an extended length of time, usually at least 10 to 15 minutes. So how often should you do these kind of exercises? How often should you work in an aerobic manner? You should probably do aerobic exercises at least 3 times a week. And we do recommend that people do them for at least 30 minutes at a time, but you don't have to do it all 30 minutes in the same time. You can break it up 10 minutes in the morning, 10 minutes in the afternoon, 10 minutes later on in the day. But 3 times a week, 30 minutes a day for each time is what you're looking for. It's important that you just don't kind of rush into cardiac exercise, but that you warm up a little bit and cool down. So we often ask you to just have some very light activity to begin with. If you're going to go for a walk, make the first 5 minutes of your walk very easy walking before you start to walk a little bit more vigorously. And the same at the end of the exercise. You want to have a cool down where you start to walk slowly and you just let your body cool down a little bit. You let your heart rate return back to where it was when it was resting. So it's important in any kind of exercise to have a period where you're warming up and where you're cooling down. So over time, you want to try to improve your cardiac exercise or your aerobic exercise. You may find it difficult to exercise for 30 minutes at first. Just even trying 10 minutes and seeing how that goes is a good idea. You want the exercise to feel moderate to somewhat hard for your breathing. If it feels like you're breathing too much and it feels more than just sort of somewhat hard, then you're exercising too hard. And if you can only do that for 5 or 10 minutes to start, that's no problem. It's a good start. Next week, you might try to add on another minute. So the idea is to just build it up gradually over time. So the second type of exercise is called strength or strengthening exercises, and these target specific muscles in your body that are weak. And there's lots of different ways that you can improve the strength in your muscles. Sometimes you'll see people, they'll go to the gym and they'll use expensive equipment and it looks very complicated, but you can actually just improve the strength of your muscles using simple things like small weights or even soup cans if you have soup cans in your house. You don't have to have a lot of fancy equipment to improve the strength of your muscles. So how do you know how much weight to use? Well, the good rule of thumb is that if you pick a small hand weight and you're starting to do an exercise, you should lift it about 10 times. And the first 5 times shouldn't feel too hard at all. When you get to the 6th time, it's starting to feel like your muscle is working. And by the time you get to the 10th time, you should feel like your muscles have worked quite a bit. But you should never feel pain. You'll feel your muscle getting tired, but you shouldn't feel like you're feeling actual pain in the muscle. Then you know you're lifting too much. The final group of exercises that we recommend are stretching exercises. And it's important as you age that you keep your muscles nice and loose and your joints flexible. People that are very tight and they have tight muscles are at risk of falls because you don't have the flexibility to be able to move in and out of your chair, in and out of a car, in and out of bed. So it's important that you can add some stretching exercises to your exercise routine. You don't need to stretch before you go out for a walk. It's usually better to have your muscles warmed up a little bit before you stretch them. So we always recommend that people do their stretching exercises after they've gone for a walk. And anytime you hold a stretch, you should feel a sense of a light pull in the muscle, but you shouldn't feel pain. So all of these 3 types of exercises, cardio or aerobic exercise, strengthening exercises, and stretching exercises are all very important. We recommend that you do aerobic exercise one day and then strengthening the next, and then aerobic exercise the next day and then strengthening the next. It's not a good idea to do strengthening exercises every single day, especially if you're really working your muscles, because you really do need a day in between to have your muscles relax and repair and get strong and get ready for the next time. You can always go out for a walk every day though. Even light activities such as walking is a good idea. And if you can do some stretches every day, that's a really good idea to keep your muscles and your joints nice and loose and flexible. So now we're going to show you some basic exercises that you can do at home. So we have a couple of people here from the Pulmonary Rehab program to demonstrate some of these exercises. Make sure that you do these exercises to your own ability. We're going to show you an easy version and a moderate version and then a bit of a harder version for some of the exercises. Make sure that you always keep breathing when you're exercising. Don't hold your breath. If you feel pain, you're probably going a bit too far. You need to back off a little bit. It may take some time doing these exercises over a few days. It might be a good idea to have somebody with you when you're trying them out for the first time. Make sure that you start low, start easy, and you can gradually build it up over time. So for this particular exercise, you want to have a blank wall in front of you. You want to be able to stand about a foot or so, a foot and a half away from the wall. And then as you can see, you're going to have your arms placed in front of you. You don't need to have your hands turned in or hands turned out. You just want your hands to be straight in front of you with your fingers pointing up. Now, in the easy exercise, you can see that Judy is just going down a couple of inches. She's just bending her elbows a couple of inches. She's keeping her body nice and straight. She is just moving forward, holding it for a couple of seconds, and then back. doing that 4 or 5 times to start with, and then moving up to 8 to 10 times as you get stronger. Now, if that feels much too easy and you want to have a little bit harder exercise, then you just need to bend your elbows a little bit more. So try going down, bending your elbows a little bit more, holding it for a couple of seconds, and then bringing it back. And then the hardest version is where you go all the way down to the wall. You can see that Judy's back and legs are nice and straight. All the movement is coming from her elbows. Remember that you never hold your breath when you're doing any kind of strengthening exercises like this. You really want to make sure you're breathing nice and rhythmically. We usually recommend that people breathe out when they're doing the hard part, and then they breathe back in when they're doing the easy part of the exercise. Okay, the next one that we're going to demonstrate is called leg extensions. And for this one, you just need to be at a counter, maybe your bathroom counter or your kitchen counter, and you're going to stand up in front of the counter, maybe about a foot or so apart, and just have your hands away from the counter, just have your hands on top, resting lightly on top of the counter. You're going to have very good posture, looking straight ahead, and then you're just going to keep your legs straight and bring it back as is demonstrated here. Make sure that you don't bend your knee. It's important that all the motion is coming from the hip, and try not to arch your back when you do it. While you're bringing your leg back, your nice straight leg back, try to clench your buttock muscles so that your butt muscles are feeling very tight and you can feel the work in them as you move it back. Hold your leg back 1 or 2 seconds and then bring it forward again. Do this one 4 or 5 times to start, and then as you feel more comfortable with it, you can try to do it 8 to 10 times. When you're really getting comfortable, then you can do a couple of sets of those of 8 or 10 sessions. Okay, the next exercise that we're going to demonstrate is called the bicep curl. For this one, you want to sit in your chair. Have a chair that preferably doesn't have arms, but if you only have chairs with arms, that's okay. You can still work on the outside of the arms of the chair. Have a chair with a good straight back and sit comfortably so you feel supported. Then take your weight and you're going to have it in your hand. You're going to be exercising these muscles that are in the front of your arm called the biceps. So your arm should be hanging down by the side, and then you're just going to bend and straighten at the elbow. Make sure you breathe out while you're lifting and then breathing in. And make sure that when you bring your arm down, that you do it in a nice, slow and controlled manner. You can do that 8 to 10 times, and then you can switch onto the other side and give your right arm a rest. And the same on this side. Now you can also do another arm exercise called a tricep curl, and in this one, if you happen to have what we call an exercise band, these are very helpful. They're lightweight and you can use them for strengthening your arms as well. So as you can see demonstrated in the video, they've got their hands. His hands are about a foot apart. Just hold one by your chest and the other one's here, and then you're just bending and straightening at the elbow. You can bring your arm over to the chest and do it from this level as well. And this is exercising the muscle in the back of your arm. And again, same idea. You're just going to breathe out, then breathe in. Breathe out as you're doing the hard part, and then breathe in. And after you've done 10 on that side, you can take a rest and then do it again on the other side. The last exercise we're going to demonstrate are called wall squats. And so this is to exercise these large muscles in the front of your legs, and also to just give you a little bit more strength around your core. So the idea with this one is you're going to stand with your back against the wall, but as you can see, your feet are going to be about a foot away from the wall, and you're going to lean back against the wall. Try to have a wall that doesn't have anything on it, and you're wearing something that allows you to slide up and down the wall easily. So we're first going to show you the easy version. You can see that in this version, Judy is just sliding up and down the wall a couple of inches. So she slides down a couple of inches, just holds it there for a count of 2, and then slides back up. Again, down a couple of inches, holds for a couple of seconds, and then slides back up. Now, if this seems too easy and your muscles are stronger, you can actually slide down a little bit farther. So you can see here Judy's actually sliding down a couple more inches, holding it, and then back up. If you really want a challenge for your legs, you can slide down even farther. It's important that if you slide down, you need to know that you can get back up. So maybe for the first few times that you do this exercise, make sure that you have somebody in the house with you. You don't want to accidentally fall. So make sure that you're strong enough to be able to slide back up. So you can see Judy slides down, holds it for a couple of seconds, and then slides back up. So it's a really good exercise to strengthen the muscles in the back of your legs and hips, and also in the front of your legs. These muscles help a lot for getting in and out of chairs and for getting in and out of bed. So for all of these exercises, it is good to try to do some sort of activity every day. At first, when you get started, you might find that very little activity makes you short of breath. You want your breathing to feel moderate to somewhat hard, so cut back a bit on the exercise or go a little bit easier if you find that you're getting too breathless. Over time, as your muscles get stronger and your body gets more fit, you'll be able to do more and more exercise. So you may find that it's a little bit easier to keep track of your exercises if you use some sort of a chart or your calendar. So we have an example here of an exercise schedule. You can see that 3 or 4 times a week you're going to do some cardiac exercise. You can do 30 minutes each time, but if you find that's too much, you may find it easier to break that 30 minutes up into 3 10-minute sessions, as we've shown here. So a 10-minute walk in the morning, 10-minute walk in the afternoon, and then if you have access maybe to a stationary bike, you can do 10 minutes of biking on the bike later on. So 30 minutes a day is what you're striving for, but it may take you some time to build that up. If you can only start with 10 minutes to begin with, that's fantastic. Just keep adding a little bit more time every day if you can. You may find that even with adapting the exercises as much as you can, you still are quite short of breath and you're finding it a hard time to do these exercises. You may need to talk to your doctor. Maybe there's a change in medication that you could have, or a different dose of the medication to allow you to be more active. It's important for you to be more active. So anything that we can do and anything your doctor can do with medications and other sorts of adaptations to allow you to be more active, that's what we want to do. So just in conclusion, we just want to summarize some of these key points. So before you start an exercise program, make sure you talk to your doctor. Give he or she an idea of what you plan for your exercise. Make sure that the medications that you're on, you understand how to use them, and have a good talk with your doctor about what the plans are. Try to alternate the walking and cardiac exercises with the strengthening exercises in your week, so you have a day of one and then a day of the other. That kind of variety is really good for your body and allows it to adapt. Exercise is a great thing to do if you have COPD. It helps to strengthen your muscles, it'll make you more physically fit. Muscles that are stronger and your whole body will work better. It tends to use less oxygen, so it really reduces the load on your lungs and you'll feel less short of breath. And it also really improves your quality of life. Exercise makes you feel better. It makes all of your systems of your body work better. So it's a really important part in the care of your COPD. So thanks very much. We hope that this video was helpful and gave you some important information that you need or that you want for exercising with your COPD. There's a lot more detailed information in the pamphlet. There's references on all the information that we've provided you. So please refer to that pamphlet that came with this video, and thank you very much.